Pregnancy is a natural process, so if it's not happening or if it's not sticking, something is missing. After having a family member go through infertility and experiencing a miscarriage myself, I realized how little support and education women have around infertility. I want to change that. I'm Dr. Jane Levesque. I'm a naturopathic doctor and a natural fertility expert. Tune in every Tuesday at 9 a.m. for insightful case studies, expert interviews, and practical tips on how you can optimize fertility naturally. If you've been struggling with infertility, pregnancy loss, women's health issues, or you just want to be proactive and prepare yourself for the next big chapter in your life, this show is for you. Today, I had the pleasure of sitting down with Dr. Katie Lee, who is a dentist. She's also an author who's written a book, Saved by the Mouth. Now, if you're wondering about why is a dentist on my podcast about fertility, you'll be surprised to find out the connection. The oral microbiome is huge when it comes to determining the health of the rest of the gut, but also the health of the reproductive system. We have lots of research and studies that are being supported for healthy pregnancy, healthy postpartum period, and healthy babies, and how it's connected to what's going on in the mouth. So this is a very exciting conversation. It's an important one to have, and I hope you guys enjoy it. Thanks so much for being here, Katie.
Thanks for having me. I'm really excited to chat with you today.
Yeah, and I think the listeners, some that have been following me for a while, are not going to be surprised to see you, while others might be wondering. And I was just telling you a story about how my team messaged me, and I was like, we have a dentist who wants to come on your show. Like, we just don't think it's relevant, but we want to make sure. And I was like, nope, very relevant. Invite her on the show. We need to talk about this.
Yeah, I'm glad they checked with you.
Yes, me too. I mean, let's go into it and tell us, why is oral care important and how is it tied to fertility, pregnancy, postpartum?
Yeah, so many things. What we're finding out and what we've known for a long time, I mean, even since the 90s, right? A lot of people started being nervous about going to the dentist when they're pregnant. And so back in the 90s, we knew that the mouth was connected somehow to fertility or to the rest of the body. And then it kind of got forgotten about for a couple decades. And now we're circling back and realizing that the mouth is actually part of the entire body and part of our systemic health. And so what we know is that the bacteria in the mouth, unfortunately, doesn't stay in the mouth. The mouth has the second largest microbiome in the body. And when our body is chronically inflamed, the tissues in the mouth start to break down, and the bacteria that are there can leak into the gums, get into the bloodstream. And one of the places they love to go, unfortunately, is the female and male reproductive tract. So oral microbiome is connected to preconception, conception, health during pregnancy, and postpartum.
And just, I mean, health in general, I think for me, when I first started diving into this world, it was a bit of a stretch of like, what's happening in the mouth is going to impact my reproductive microbiome.
Yeah.
But when you think about, oh, okay, I swallow 300 to 400 times a day. If there is some sort of an infection, I'm literally just swallowing it down into my GI tract, which then the body has to deal with. It is also super close, like you said, to the blood supply, to the nerve supply, which I remember I had a toothache, and it's like my whole body was just like, I can't do anything.
Yep.
You know, because
Totally.
it felt like it was just shooting into my eye. So I think we're like getting there where teeth are really important. But that's what made me help the connection. It's like, oh, it's related to my gut, and then my gut is related to everything else, you know?
Yeah. And you're right. We do swallow about 1 liter of saliva a day, which is kind of gross if you think about it.
It's
We
huge.
swallow over 1 billion microbes. And thankfully, our stomach is super acidic. And so most of that bacteria is going to get killed off in the stomach and the first part of the small intestine. The dangerous stuff that we really have to be worried about is the stuff that gets in through the gums. So when people are experiencing bleeding gums, that means that they have what's called leaky gums. So a lot of people are very familiar with leaky gut.
Yep.
The same enzymatic process that is causing leaky gut causes leaky gums. They have the tissues have this very similar histology. And so the gum tissue starts to break down. And the reason why your gums bleed is because they have a blood supply in them. And so that's how the bacteria in the mouth are getting into the bloodstream. And once it's in the bloodstream, it's fair game. It can go to the brain, the gut,
anywhere.
Anywhere. And we know that oral bacteria, such as Fusobacterium nucleatum, should not be in the uterus. And that's where we end up getting a lot of problems, is when it does get down there.
Yeah. You know, it's funny, the argument point that we should have the stomach acid to break it down. I
Yeah.
think that most of us do not have the stomach acid that we're
Correct.
supposed to. So it's like that's a kind of a bit of a double whammy. I'm like, we're supposed to,
We're supposed to.
but because we're
Well,
so
and
stressed and blah, you know.
a lot of people are on stomach acid inhibitors, right? Like PPIs and stuff like that,
Yep.
which, has been shown to cause all sorts of health problems down the road. But we're actually deficient in acid, as what you said. And then we take medications to make us more deficient in the stomach acid, which doesn't make sense. It doesn't even fix anything. So you're correct.
Yeah. Tell me, are you testing people? How do you know, besides having, so when I do my intake, I always ask about dental just so I have an idea because for some people, they've
Amazing.
never made the connection that, oh, a woman that has, 4 root canals and recently infected and struggling with fertility, like even for males, I'll always make that connection. But then I just send them off to people like you because obviously that's not my specialty. But are you doing testing with people, and what are you finding in those tests?
Absolutely. So that's what's really great about dentistry is in the past, we haven't really had any sort of objective testing that we could do for patients. Everything was just us looking at x-rays and trying to figure out what was going on or using subjective judgment in the mouth to determine if there was infection. Now we have saliva tests that are painless, inexpensive, and easy to do. Patients can do it from their own home. So I'll send a kit to a patient's house. They can do a saliva test, ship it back in, and then we'll go over the results together. And there's some 3 specific bacteria that I screen for 11 of them, but I look at 3 specific ones when I'm thinking about fertility issues. They're TF, FN, and PG, because we know that those directly impact fertility for both men and women. So, absolutely, unless you test for them, you don't know if they're there. And what's also really important about testing is that in the past, as dentists, we've treated all signs of infection the same and done the same treatment for all of them. And we have been horribly ineffective at making patients better with their gum health and with cavity health, because what we're knowing now is depending on the type of bacteria, obviously, and this makes sense probably to you because you're a doctor, you have to change your treatment depending on what bacteria are present. But in dentistry in the past, we haven't done that. We've kind of done one size fits all treatments. But now with this test, once we know what's there, we can tailor treatment to eradicate bacteria that shouldn't be there.
Yeah, I think that's always, like you said, we've been terribly ineffective. And even with natural medicine, like that's some of my gripe because when I first started practicing, I didn't test. One of the reasons is because testing wasn't as available as it is now. And then the other reason is like you're not really taught that in school. You're kind of
Totally.
taught the physiology, you're taught like the bare minimum. And then when you go out, they're like, as you practice, you'll learn, which is
Yeah.
terrible. But, I've done lots of mentorship and realized that like I'm kind of just shooting in the dark here. Like bloating can be caused by 10,000 different things. And if I just guess one of them, like, hey, for some people that works, but most of it doesn't. So I'm curious, you said 11 different because then you said there's like a billion different bacteria, but we're only
Yeah.
testing for 11. Is this
Yeah.
just the limitation in testing or we don't really need to test the other stuff yet? Or, do you think that there'll be more testing that comes out around this?
Yeah, I think all of the above. So we have currently, I think the last number I saw was 754 different types of bacteria in the mouth. And when you have a microbiome, it's an ecosystem, right? And so we have good bacteria, we have commensal bacteria, we have bad bacteria. And what we're learning is there's some bacteria that, they're always there, they really don't do anything. But then there's really good beneficial bacteria that we want. And
Yep.
we want to try and supplement those and make sure that they're robust and diverse because they're the immune system, they're the defense of the mouth. And then there's these 11 or so pathogens that we know cause a lot of gum disease and systemic illness. So when I'm talking about screening for fertility, I'm really looking at these 11 because these 11 are really responsible for systemic inflammation, which is related to endometriosis and PCOS and all kinds of other things, heart disease, all the things. And so I'm really focused in on those 11, but I think there's a lot out there that we still don't know. We can test for beneficial bacteria, which is great. We can also test for bacteria that cause bad breath. We can test for bacteria that cause tooth decay. So the tests are becoming more and more robust, yeah, as time goes on, which is really exciting.
Yeah, I think the field is exploding. I mean, I know that there's more to come out on the gut because if I see a list of like the main ones that we find, I know it's not everything. You know
Yeah.
what I mean?
Yeah.
Like you just can't because we don't have, but you can start to piece that information together. Like vaginal microbiome is another
Yes.
big one that's I've been
Yes.
running lots. I wonder, have you ran the vaginal microbiome? I know that maybe not, but like, have you seen the correlation? Because that's what amazes me when
I have
I test the
not.
gut and I'll test the vaginal or something, and it's like, oh man, this is just completely, it's all intertwined and related.
It's all intertwined. And it's funny you mentioned this because I'm in the process now of creating my own fertility, women's health, well, not just fertility, but women's health oral microbiome test and vaginal microbiome
Oh,
test. So I'm
amazing.
really excited about this. But yeah, I was just talking with a chiropractor yesterday. We're doing telehealth sessions with her, and she's had a lot of gut issues that kind of started back in 2019. And of course, has gone to all the typical Western medicine doctors. They say she's fine, but she's noticing significant bad breath, acid reflux. She's noticing urine odor, bloody stools. And then she's all of a sudden getting cavities that she never has before. So clearly, there is a microbiome disruption in the entire tube. And, everything is connected. It's one big tube. And so, what I always try and tell people is you can't have a healthy gut without a healthy mouth, and vice versa. You can't have a healthy mouth without a healthy gut. And so oftentimes, you have to start somewhere,
Yep.
get that kind of under control, but then keep testing either upstream or downstream. Because if you don't, you're just going to relapse and you're never going to get healthier. And so it's really fun to be talking to providers like you so we can kind of integrate all of our specialties to make people well.
Yeah. Tell me about testing partners too, then, because as soon as you're like, when you're
Yes.
just going to be reinfecting, and I'm like,
Yes. Thank you.
there's a
I
couple
love that you
other
brought this
ways
up.
you're going to be reinfected. So let's talk about that.
Especially with fertility, right? And so I'm always telling patients, like, I need to test you, but I also need you to bring in your partner.
Yes.
Because whether you're having a conventional pregnancy or not, you're still swapping microbiomes
If
because
you
you're
shared a fork, if you just breathed close to one another, you
totally,
touched
you're
one
sharing.
another, microbiome
Yes.
sharing, transference. Yes.
Yes. Thank you for bringing that up. And so I'm always telling them, yes, I can test and treat you, but I also need your partner in here because, I can get you better, but within 6 weeks, you're going to be reinfected if they have some of the species. And so what I find is when I test partners, they have pretty much the
The same.
same exact microbiome profile. Now the levels are different, but
Yep.
same map in
And how
terms of
the
what's
symptoms,
present.
I find the symptoms that are presenting is different. That's
Yes.
what boggles my mind because I'm like, it's the same bug, but you're
Yeah.
presenting like this and he's presenting like this.
Well, and especially between males and females, right? The symptoms are going to be different, which, that's why men have crushing chest pain for a heart attack and women, have nausea, right? So
Yeah.
symptoms present differently depending on, male or female. But what we know is like for men, PG, Piformonas gingivalis, is really implicated in their male reproductive system. So PG bacteria is going to kill the sperm. So it's going to reduce the sperm count. It's going to make the sperm not swim as efficiently. So slow
I
swimmers.
hope people are listening to this very closely because they're
Yes.
just like, my sperm count is low. What do I do? I need to take vitamin
Yes.
C. And it's like, you have to figure out
No.
why it's low. Figure out the
Yeah.
why first.
You probably have a bacteria infection in the sperm, which is very common, as you know.
Yeah.
And it can be caused from PG originating from the mouse. So PG can kill the sperm. It can change the shape of the sperm. So the morphology is not ideal. And then that can lead to slow swimmers. So a lot of times people will say, well, we have to do IUI because my husband has slow swimmers, right? We're going to put the sperm right into the uterus because it's not.
Well, we're going to wash it first. And
Yeah.
I think the hope there is that the conventional system, anyways, the way that they see it is like, well, if we just wash off the stickiness, then it's good.
Yeah.
I think
Yeah.
what's important to remember is that when you wash off the stickiness, it does not change the nutrient level or the DNA fragmentation or anything else, the vitality about the sperm. So sure, you have freed it up, but you haven't changed the quality of the sperm.
Yeah. And
That's
if the sperm
really
quality is
important.
not, and that's why IUI is horrendously ineffective, right? Like
Yep.
really ineffective. And so I always say, like, let's test for PG. Let's see if you have it. PG also impedes arginine production. And arginine is a precursor to nitric oxide. Nitric oxide, as you know, is a very potent vasodilator, which is needed for men to achieve erections. So there's a very
And
close
heart function, right? Like there's huge connection in cardiovascular disease and erectile dysfunction.
Yes. which is why a lot of people on that have cardiovascular disease are also taking ED medication, right?
Mhm.
And there's a very strong correlation between ED, heart disease, and perio disease. And that's all caused by PG. And so I'm always telling the men who are, as men are always like, oh, I really don't care about my oral health or whatever. I'm healthy, until you start talking about ED. Then they're like, okay, I'm paying attention now, because I don't want any of that to happen.
For sure.
So yeah, it's very important to test men. And then we know PG in women makes it very difficult to conceive, because PG can impair or impede ovulation. It can impede the embryo implanting. And then it can increase the risk of preeclampsia and gestational diabetes down the road. So PG is very dangerous. The other big one is FN, Fusobacterium nucleatum, which I mentioned. FN, what we're finding out is FN is really bad all over. It very easily gets into the bloodstream and can transmigrate through tissues. The other thing about FN is it's kind of like the Uber of the body, in that it very easily swims everywhere, but it also picks up other bacteria and takes those around with it that normally wouldn't be able to get to certain places. So we're seeing a lot of colorectal cancer being
Mm,
caused by FN. We also know that if FN is present in colorectal cancer, that it decreases the effectiveness of chemotherapy and
mhm.
increases the chance of reoccurrence. There was a big study that came out in 2022 or 2023 about FN causing over 20% of endometriosis cases, and it's FN from the mouth. And FN in pregnancy is really related to premature rupture of the amniotic membranes that can lead to either stillbirth or miscarriages or
Preterm labor. Yeah.
preterm labor and low birth weight babies. So this is, in my mind, all really good news, because FN is treatable. And so if we know someone has FN, we can very effectively treat them and hopefully prevent a
Yep.
lot of these complications.
Yeah. There's a couple questions that popped into my mind as you were talking. So even like with PG and FN, because you're talking about all the things that happen down the road, how do you know that you might have it outside of testing? Because I find that most people are not doing the testing unless there is a
Yeah.
problem. But like, what are some signs and symptoms to look out for to be like, oh, besides not being able to get pregnant? Because I
Yes.
think that there's so many other different factors that could be causing that, but just specific to these bugs.
Yeah, I will say, so I do a lot of telehealth saliva testing for patients. I will say 95 out of 100 of the people I test for have an FN infection. It's that prevalent.
What are the symptoms do they have?
So a lot of times they don't have any that they are aware of. The
Yeah, and
people,
that's why I'm like, can we bring awareness? Because they have
yes.
symptoms, they're just not aware of them.
So sometimes people will have occasional bleeding gums, not all the time, but occasional bleeding gums. And they'll say,
Hmm.
well, it's usually when I floss too hard or when I brush too hard. The chances of it being because you're doing something too hard, it's probably not the case. It's usually because there's an infection there. If you don't floss, which only about 5% of the population does, chances are you have an FN and PG infection. Bad breath is going to be another symptom that
Mm.
we'll see receding gums being associated with this. So if someone says, my gums keep receding over time, but my dentist says everything's fine, that's usually an indication. Sensitive teeth could be an indication of that as well. And then oftentimes these patients have gut issues. So bloating, constipation, loose stools, things like that. Because again, the mouth is the beginning of the digestive tract. So we'll see a lot of gut issues.
Yeah, that's perfect. I think I always like to connect it because a lot of the times we just don't think we have any issues because we've set such low standards for what
Totally.
it means to be healthy.
Yeah.
Like people are literally sick coming into my office. I have a couple that I'm like taking on today. She has insane liver enzymes that are elevated. Like I haven't even met her yet. I just looked at her lab work and I'm like, why is she being prescribed IVF? She has fatty liver disease. Like she's sick. It's crazy to me.
Yeah.
I'm like, we need to stop normalizing that, like, oh, it's just your liver. It's
Yeah.
like, what do you mean it's just your liver? It's like, you can't live without a liver.
Your liver runs your body. Like
Yeah.
everything has to go through the liver. And people have been sick for so long. A
Yes.
lot of patients that will come into me will say, well, I have bleeding gums, but my gums have always bled since I was a teenager. And it's like,
That tells me you've
that
had
may
that
be
infection for
common for you, but
decades.
it's not normal. Yeah, it's
Yeah.
not normal. And I used to test kids all the time because parents would have gum issues. So we would do a microbiome test for them. And as you said, if you share a fork, you're going to transfer microbiome. So I'd always say, let's prevent your kids from going down the path that you have. Because once you have gum disease, you have it. We can't get rid of it. We have to manage it now. So I'll say, bring in your kids because I want to test them. Shocking, right? Their microbiome profiles are the exact same. And so we would treat kids pretty aggressively because I don't want them to end up like their parents. And especially when someone says, I've had this my whole life, right? Like that may be common for you, but it's not normal.
Yeah.
Let's fix it.
Yeah. And I think I was talking about that because we didn't have the level of the access to the information that we have now.
Totally.
And so then you couldn't go and see if that was normal or abnormal. It was just like you didn't have access to it. But now that we do, and I'll say, because my people will get overwhelmed. They're like, oh, great, now another thing. It's not that it's another thing. It could be the thing, though, that's preventing you from getting pregnant. And to me, like, knowledge is power. If you're listening to this and you're like, I think something's going on in my mouth, it is 100% worth checking out, you know?
Thank you. Well, and what I always tell people is, the best time to uncover this and treat it is before you're trying to get pregnant, right? So if, let's say you are just starting family planning, you don't know if you're going to have trouble or not yet, get a microbiome test because the best and safest time to treat you is before.
Yes.
If you've been trying to get pregnant and you can't get pregnant, get an oral microbiome test because it could be contributing to systemic inflammation or sperm issues in your partner, and we need to treat it. If you're already pregnant, though, I still really recommend to get tested because, again, if you have FN, that could lead to preterm labor and a low birth weight baby or a miscarriage. And so there's very safe, effective things that we can do during pregnancy that will eradicate that bacteria from the carrier and make sure that they're,
or at least keep it at bay, right? Like
or
I
keep
always
it at
say,
bay.
keep
Yeah.
it at bay. The most important thing is to keep it at bay so then it doesn't get into the nerve supply and, blood supply as much as possible to prevent it from going any further.
Well, and we know that FN and PG actually get into very easily and affect the fetal artery. It causes a lot of inflammation in the fetal artery, gets into the umbilical cord. So it definitely affects the growth factors and the nutrients that get to the baby. And when you're pregnant, you're what? I don't know the exact stat, but you're doubling blood volume or something like that.
Pretty much.
And so your blood vessels are huge. You get leakier because of all the progesterone that's flowing through your body. So if you did have a little bit of dysbiosis in the mouth, that's going to much more easily get into the bloodstream when you're pregnant than when you're not. So very important.
An immune system is a little bit suppressed too, right? When you're pregnant.
You can't fight off things. So even more important to take care of yourself when you're pregnant. And I always tell moms, like, you deserve to take care of your health and yourself while you're pregnant. Like, you are growing a human being, take time for yourself because the better you are, the better your baby's going to be.
Yeah, I always have to say that to my patients. So it's like, just because you don't have a baby, like because a lot of the times we'll wait until we're pregnant to start taking care of ourselves. And it's like, no, like you have to do it before, you have to step into that energy because pregnancy is a really vulnerable state, like emotionally vulnerable, physically vulnerable. And vulnerability was something like I had to learn because I was the go. And I know what that feels like, it's like, oh my God, it feels like you're on the edge of a cliff. It doesn't feel right to be, but you're going to be vulnerable for a really long time throughout the pregnancy and postpartum. And you're going to need and depend on people to help you. And for some women, it's like, that's very difficult. And one of my patients right now, it's like, she doesn't even want to think about having to depend on people, because there's a trauma obviously around it, but it's just like, well, if you can't do that, there's no way your body will even let you get pregnant.
Yeah, that was one of my biggest struggles with getting pregnant. I struggled for a long time. And even after that baby's there, like it takes a village, it takes a village to raise that kid.
Yeah. Oh yeah, it does. Tell me, will you share some of the treatment? I know treatment protocols are specific, but like, what are you doing? Are you doing antibiotics, prebiotics, probiotics? And I always like to give people a window into like, what does the intensity look like? Because sometimes like ureaplasma, I'll use that as an example. A lot of people are like 5 days of doxycycline and you're good. It's like usually it's 10 days and you need a Zethro and Doxine and you need antimicrobials for another 4 to 6 weeks and you might need antimicrobial suppositories like garlic. When people hear that, they're like, oh, that's why it didn't work versus like, I guess, this bug is just part of me. So I'd love to give a bit of an idea of like how much and what do you do?
So the basic step is to get, what's called a deep cleaning or scaling and root planing. So what's really important to understand is that the bacteria that live above the gum line in the mouth are oxygen-loving, mostly beneficial bacteria. The bacteria that are causing disease live underneath the gum tissue, and they're oxygen hating bacteria, so gram negative. So when people say, oh, I just want a regular cleaning cleans above the gum line. It doesn't do anything for disease control or treatment. So you have to go beneath the gum. So that's called a deep cleaning, or the technical term is scaling your root planing. Once we do that, that's just to remove all the debris that's down there and to smooth out the root surfaces to make it harder for bacteria to reattach. Once we do that, now it is down to let's treat the specific bacteria. So half of the bacteria that I test for are resistant to cleaning. And this is why a lot of people never get better when they keep getting deep cleanings over and over again. So then we have to use antimicrobials to kill the bacteria. Ozone is really effective at this, actually. Another thing that we like to use is tissue lasers, because some of the bacteria, there's about 4 of them that are tissue invasive, which means they don't love to live on the root surface. Instead, they burrow into the gum tissue and hide there. And that's really dangerous because they're difficult to reach, but that's where the blood supply is. That's where the little capillaries
Yeah, they're close to the blood supply. They're close to where they need to go.
Yes, so we have to get into the tissue and treat them. So tissue lasers are really effective. Once we do that, it's really important to rebuild the microbiome, because we're essentially going to wipe it out when we do this treatment. Sometimes it's so severe, and if it's gotten into the systemic blood supply, that we will do antibiotics. We absolutely have to get rid of it. But then we have to reseed the oral and gut microbiome to make sure that we're putting back what we want to be there, so that hopefully the patient can maintain that on their own. And it can fight off any future infections. So we'll do some prebiotics, some probiotics. I also recommend dietary changes depending on their microbiome and systemic inflammatory levels, which nutrition is so important. And a lot of people don't realize food is medicine. And then supplementation is also really important, because I feel like most people, including myself, we don't eat the way we should all the time. And the food that we do get, unfortunately, is not as nutrient dense as it should be. And so there are really great supplements for oral health that people can take. And then the most important thing is to retest. So I always recommend a retest in 3 months, because we need to make sure this thing is gone. And oftentimes, if someone has had a really long standing infection, which most people do, you can't get rid of it with one go. It's really tough, like SIBO, right? SIBO is really hard to get rid of. Sometimes it takes a couple passes before we can get it completely gone. Or sometimes we do really good at treating one bacteria and we'll get that bacteria down, but another one will spike. And so sometimes it takes a couple rounds. So retesting is critical. And then after we get the patient healthy, I always say once a year. We need to test you once a year, just like your annual physical. We need to check to see, are you on track? Are you starting to get off track again? If so, let's intervene early. That way the treatment's not going to be so in depth.
Yeah. I smile because my husband is always just like, man, it's so much work to be a human.
It is. It is.
It's insane. And I think some of it is, it's necessary. Obviously, some of it I think we create for ourselves, but we just don't have a good, and the society is a reflection, but I don't think we have a very good system for our actual health and health needs, because it's like every year you should get your gums checked, and you should look at the stool analysis, and you should look at the blood and just see what's going on. But, we're not told those things.
I think like society's not set up for health, right? Like if you go to the grocery store, like that is not.
I don't anymore, because I'm like, this is terrible.
Yeah,
is this what people are eating?
We're not set up for health. And then with how many people are on the planet, how many microbes are out there, we're not set up. But I will say, I think that once someone gets healthy and can stay there for a long time, it gets easier. It is a heavy lift up front, but once you get to the place you need to be, it's much easier to maintain down the road.
Yeah, I agree. I mean, you said a thing about diet, like it still blows my mind when people don't think diet is important. I'm like, the food that you eat literally becomes your cells.
Yeah.
And then the food that you eat when you're pregnant literally becomes your baby.
Yeah.
Like if that doesn't make you go, oh my God, I need to think about what I put in my mouth.
Yeah.
Like, I don't know what will,
Food is information, right? Like you're telling your body what to do essentially. So if you feed it crap, you're telling it to operate like crap. I mean, that's simplistic terms, but sometimes simple is best.
Well, yeah, like if it's refined carbs, and then even if not refined carbs, let's just say carbs. It's like carbs are there to produce energy.
Yeah.
And so if you eat carbs, but then you don't actually do anything with that energy, then it tells the body to gain the weight.
Yep.
right?
Yep.
Versus like if you go into workout and whatever. So yeah, I agree. It's very much just information of what to do. And then there's just like needs. You need protein. Like every process that I test is dependent on some sort of amino acid, in some way, shape, or form. So it's like if you're not eating protein, it's like your body has nothing to rebuild itself. It almost has to break down.
You can't repair. Yeah. And
Yeah.
especially when we're thinking about, when you're trying to build a baby, protein is so important, right? And when you're trying to repair, and heal from a procedure, I tell my patients this all the time. We need collagen repair around our gums, so lots of vitamin C, and we need repair of structure, so lots of protein. So I'm always, always, always telling them, like, you do not be deficient in protein, do not be deficient in fiber, and do not be deficient in water. Those are the three things that I harp on. Because I just try and make it as simple as possible, because I'm not a nutritionist, I'm not a naturopath. I just try and keep it simple for oral health.
For sure. But I do think like those are my basics. It's like there's nutrition, there's sleep, there's hydration, movement. And I think you just have to know where you feel comfortable. But like water, fiber,
Yeah.
I don't think that's a stretch to say. And when people, like this was my question to you as well. It's like you kind of have to look at the whole person, because if you're just treating the mouth, but they're not doing any other changes, like how effective can you really be?
Yeah, thanks for bringing that up, because I struggled with that. I had several offices, but I had a main practice here in Colorado, and I would be saying all of this, like, hey, we're going to treat this, but I need you to go see your cardiologist for your heart disease issue. I need you to go see your endocrine for your blood sugar. And patients would always tell me like, oh, I don't have that doctor, or I can't get in for 4 to 6 months, or I went to them, but they said that they have no idea what you're talking about.
Everything is fine. Yeah.
Everything's fine. And so actually I ended up selling out all of my practices at the end of 2022. And that's when I wrote my book, Saved by the Mouth, and had my son. And I'm in the middle of building a full oral systemic health and wellness center in Colorado that opens in April. I'm really excited about it, because we're bringing all of the practitioners into one location to practice in one office. So naturopaths, functional medicine doctors, chiropractors, endocrine, cardio, dentists, hygienists, airways, sleep. It's all in one center. So I'm really excited about that.
That's amazing. Yeah, I think like I'm a virtual practitioner, but I'm always looking for people that I can help connect, because that's a big piece that's missing in the medical, in conventional and alternative, where people will hyper focus only on one area, but it's like you have to treat everything.
Yeah.
Or at least you have to recognize, you have to recognize where the issue is so you can refer, because you're not going to be an expert, but you have to look at everything.
Totally.
You can't just, only the uterus is the problem.
Yes. Which is what, I was a fertility patient for a long time. And that's why I'm so passionate now about fertility and women's health and oral health, is because as a fertility patient, I spent hundreds of thousands of dollars trying to have a baby, and they only looked at my uterus. That was it. And when things weren't working, I kept saying, well, why? What else could there be? Let's explore something else. And they would just say, nope, we just try again. And they wouldn't even change the protocol that they were using. And I'm like, we're doing the same hormones, the same protocol, nothing's changing, but it's not working. Like, this is insanity, right? The pure definition
it's actually
of insanity.
definitions.
Yes. And so I actually, being a dentist, I knew how much oral health impacted it. So I had no symptoms, but I was like, let me make sure my oral health is on track. Took a CBCT. I had a root canal that had abscessed and had no idea. And if I wouldn't have been a dentist, or if I wouldn't have known that would have been very unhealthy for my baby, right? So luckily I was able to get that treated before getting pregnant, but I was baffled. And I went to one of the most famous reproductive endocrinologists in the country, and they did not ask me about my oral health. Wild.
Yeah. Yeah. No, it's kind of crazy. I finished talking about this. I'm like, make sure your clinic is patient-centered versus money-centered.
Yep.
And it doesn't mean that you're not going to pay a bunch of money. What it means, though, is the clinic is driven by results, not the amount of money that they make.
Totally.
Because it's like, I run a business. I need to have my profit margins. I need to make sure that it's healthy. I need to charge a certain amount that everybody gets paid and all that jazz. But like the drive is to get the result, not to make so it breaks my heart. And that's why I educate so much, because it's just like, we have to start speaking up about this stuff, it's brutal.
And the practitioners need to be curious, right? Stay curious. I always think.
Yes. Yeah. If you're not curious as a practitioner, what are you doing?
If you're a patient, you go into someone, even a dentist, right? And they don't ask questions. If they're not asking you questions, asking about your history, asking about your habits, your lifestyle, all this stuff, if they're not curious, it's probably not the right practitioner.
Yeah. And again, that's probably, again, because people will ask me that, like, well, why are some practitioners? I'm like, I think most of us get into the field in medicine because we want to help people. There are some people who get into the field because of status.
Yeah.
And so you have to be able to pick out who's who,
Yeah.
So is that, thank you for sharing your story. Once you treated your mouth, was that the reason that allowed you to get pregnant?
So I ended up, sadly, no. We still don't know to this day why I couldn't get pregnant. It was unexplained infertility. I really believe, and people are going to think this sounds woo woo, I think there's a lot of inner emotional stress, that you can be totally blocked. Because I used to say all the time, like, I know I'm blocking this and I don't know why. Because I want a child, but somehow, like, I have this subconscious block
Yep.
that's not allowing it to happen, which everyone, a lot of people thought I was crazy. So I ended up having to have a surrogate. So we were down to our last embryo, and I was in and this was several years ago. And this was before I knew all this stuff that I know now, right? Which is why I'm so passionate. And this is why I'm sharing all this information. I was given no more answers about what else can we do to try and make this work. It was, we have no idea why you keep miscarrying euploid embryos, because we genetic tested them. They were totally fine. We put them in, we get a heartbeat, and it would be like around 10, 12 weeks that I would miscarry. And it would just be a stopping of the heartbeat. It would never be, abortion kind of miscarry. And so, yeah, without any answers, I was like, well, I'm down to my last one. Like, we got to do something different. And so I ended up having a surrogate. I wish I could say it was the root canal, but
Yeah, I think I'm studying with Dr. Leah Hitchman, and she's a phenomenal practitioner of reproductive health, fertility. She has like a year waiting list, which tells you a lot about a fertility specialist and that people will wait a year to see her. We're actually just learning about pregnancy loss. She has a whole mentorship. And when you miscarry really depends on what's going on. So that 5 weeks before versus the 10, anything after, I think she said 6 or 7 weeks, it is related more to infection and some sort of immune system dysregulation, because there has to be a really big acceptance of the embryo. Immune system, I think, is like involved in basically everything. But yeah, there's always, what I'll say to women is like, if you really want to have a baby, you'll have a baby. It won't turn out the way that you thought it would. It'll probably take you longer. It'll spend, more money than you think. But my wish for you is that you have peace through the journey, because you have to heal through it. And sometimes it takes years after, even having your babies to be able to heal with it. Because when you're in it, it's like, it's really hard.
Well, and when you're in it, you're kind of in fight or flight, right? Because you're like, I want to get pregnant. I want to get pregnant.
It's so hard not to be. And you try not to be.
I'm getting old. I'm getting old. I'm getting old. I have to do these drugs. We're miscarrying again. We're pregnant again. We're uncertain, so you're kind of in fight or flight or at least I was for a very long time.
I had a patient on a call, and she's 40, and she has a lot of guilt about not starting earlier. And because now she's like, I feel like I'm anxious because of this whole journey. And I'm like, I have a hard time believing that you were cool, calm, and collected a year ago. Like, I think it's bringing it out. And like you said with energetics, I think energetics is the thing. And we're carrying so much generational trauma for like this patient. I'm like, was your mom like this? Yes. Okay. So is there a chance that you have no idea what it's like to have a regulated nervous system? Yes. Okay. So like now we can have a bit more compassion for ourselves to say, oh, this is a skill that I do not have because I was literally born into a dysregulated, like when you're carrying your baby and you're highly stressed and anxious, your baby is with that because you are that. Baby is coming. And I don't say that to like freak people out, but it's like, I just think it helps us have more compassion to be like, oh, I have to learn this whole new skill.
And the great thing is
there's a lot of spiritual
we can learn it, right? That's what's really exciting.
Yes.
And I try and challenge people's mindsets sometimes is like, just because you don't have something doesn't mean you can't acquire it. And I love that we can learn stuff like that. But even having a traumatic birth, right? Like if you were born
Yep.
traumatically because of, you know, you got stuck in the canal.
I had a traumatic labor and
Yeah.
birth, so like my daughter, and I could see the difference between two of them. Like one was born at home, super peaceful, versus like the
Yeah.
hospital, the forceps,
Yeah.
the, and they're completely
Yeah.
different. And I know it's, it has a big part of their nervous system and regulation,
Well,
all
this
of
is
that.
fun to talk about because I've never actually had this conversation on a podcast before. But yeah, I had a
That's great.
traumatic birth. I was born traumatically. Wrong way, forceps, breech, backwards, broke a tailbone, all the things, right? So,
Oh my God. Yeah. But it like, to me, when I take a patient's history, and this is the feedback that I get, I don't go, like, I want to know what happened through your fertility journey, but then I want to know what happened when you were a teenager. Obviously, any other milestones that were important, like whether it was a death or a big move or something like a breakup that was really. And then we go further into teenage years because that's the time where the brain made the connection to the ovaries in the first place. So if there was a lot of distress, I had a patient who was literally in a war, like genocide war, when she got her period. It's like, are we really wondering why she's so stressed all the time? Do you know what
wow.
I mean? Or like why she's struggling with infertility. And then you go further back between the ages of 0 and 5, and then, oh, I was born and I was a small twin, or my mom was really stressed, right? So, like I said, I think it just gives you more
Yeah.
compassion and understanding that, like, oh, this isn't going to be I'll take this supplement and I'll fix it. Or I'll get rid of, like, speaking about infections hold a space for what you energetically haven't dealt with. And maybe it's not even you haven't dealt with, but your generation hasn't dealt with. And so I've had people who've been parasite cleansing for years. And it's just like, you haven't actually dealt with the energy of the infection. So, they're just not going to work
Wow.
because you have to change. You physically have to change emotionally, mentally. Like, it's an evolution. And I think, like, that's what's really cool and
Yeah.
exciting, because you can change and evolve into a different
Yeah.
person. You can make that choice every day.
I'm learning so much. This is fun.
Oh, good. Yeah. And that's a clinical pro for you, though. Like, if you're seeing someone with the same infection over and over again, it's they haven't
Okay.
dealt with the energetics. And again, something that I've learned, and I just see it all the time
I
now.
just wrote that
I
down.
can't unsee
Yeah,
it.
I just wrote that down.
Yeah.
So what type of energetic healing? Like Reiki or what?
No, not even. It's just like, if you think about parasites are very big. So they take up a lot of physical space in the
Okay.
body, and so they will change personality for the person. If you think about kids who have parasites, they act out a lot, like they're not themselves. For adults, what I see is like, it might be depression, it might be anxiety, it might be aggression. Like, you're just not comfortable in your body because you have this thing that's like overgrowing and taking all of your nutrients. So you usually are really tired and depleted, whether it's your ferritin levels, your B vitamins, your like everything, because parasites are just big. When you get down to more mold and fungus, like fungus is there's a lot of suppression. So men usually get impacted by it a lot because men are quite suppressed, right? In terms of expression of
Totally.
emotions. And mold and fungus, it's like, it's cold, it's damp, it's heavy, it's sluggish, right? Like, just if you think about what
Yep.
fungus looks like, bacteria are overwhelming. There's so many of them. And so this is what I pay attention to now. And again, thanks to my mentor, is like, how are they talking? Because a lot of it's not them talking, it's their pathogen talking to
Wow.
us. So then I can start to pick it out. And then the testing just shows us what's most important.
Yeah,
'Cause
that's
to
why
me,
the
honestly, like,
microbiome, health is so important. People
yep.
always say we're our cells or our DNA. It's like, no, we're a bacteria where we are a microbiome, right?
Yeah,
Yeah.
bacteria and maybe really viruses, and so that's why COVID, and there's like EBV, CMV, the herpes, like all of that has a huge impact on humanity and evolution. And I think we're very much going through that with COVID, and it'll be interesting to see what happens. But yeah, that's what I mean by energetics, is like, who is the energy of the person? What
Yep.
it is for them is going to be different. I think this is where you're just kind of digging into helping understand, like, if there's a lot of trauma around the dad not being present, or the mom not being present, or the mom being overburdened, and so there's no trust in yourself, fear, whatever, you still have to process those emotions. But then as you process the emotions, I don't know if you've had that experience,
Yeah.
you're like, oh, I feel different. Like, I feel like somebody, right? I put on a new pair of
Or weights
glasses,
lifted
if you
off
will,
my
or there's a new
shoulders or something.
lens.
Yeah.
I didn't see That's it. Yeah. Oh, I'm seeing things differently. And then once you see things differently, you start to do things differently. So it might be as subtle as, oh, I said no to this event. Like I'm not going to the baby shower because I should. I'm not going because I'm setting boundaries, right? And so your immune system, literally what it does is sets boundaries between the pathogen, like the outside world and the inside world. So when that immune system is overwhelmed, it's like, oh, usually there's a huge lack of boundaries for the person. So it's teaching them how to do that and where they learned it or, whatever. I think it's just like these little nuances. I don't want to say I can't explain it, but, a guy I had yesterday, he's like, oh, I've just always worried. And I'm like, yeah, but you were a baby at some
Yeah.
point and you didn't have a worry in
Yeah.
the world. So where did you learn that? And so it just makes people think a little bit deeper to say like, oh, I did learn this skill. I did learn to worry. Oh, it's because my mom worried. And then they can start to piece that information. And then all of a sudden it's like, oh, man, like that's not mine. That's this person's. I've just been carrying it.
Yeah. Totally. I just acquired it. Well, and once you do something for so long, it can get hardwired in your brain, patterns can. And what's really cool about neuroplasticity is you can
Yep.
make new connections, right? And your body can heal and you can learn new
Yep.
things. And that's why I find health so fascinating. Every day, like talking to you right now, I learn new stuff and there's so much knowledge out there. Every day, mostly every day, I have a new book coming to my house and my husband's always like, what did you order today? And I'm like, I was talking to this person and they mentioned this, so now I want to learn about
So
this.
the book that I really like that goes well with what we're talking about is It Didn't Start With You. I think it's
Oh, I have that.
right?
It's so I have a bookshelf of things I've read and then I have a bookshelf of things that I haven't read. So yes, that's on my shelf and I will cue that up
There
next.
you go. Yeah, well, I ended up switching to Kindle because I'm like, I can't buy any more books, and the Kindle I've actually enjoyed more
I
than I
do.
thought.
I'm trying to, yes, because books are not good for the environment. So what I'm doing now is I'm buying used books like off of, what is it, thrift books or something like that. So I'm trying to do used books because there's something for me about physically turning a
I
page. And I
know.
love to like notes and I write stuff down, which I know you can do on Kindle now. But yes, I need to adapt and modify because yes.
So we do a little bit of both
Okay.
because I was very attached to it as well. But then I'm like, if when I'm traveling and I have like 2 or 3 different books that I'm reading,
Yeah.
I'm
It
just
takes
like,
up
I
so much
can't bring
space.
these. Yeah, versus it's like it's a notebook,
Yeah.
So
I need to do
that
it.
I really like that book, and like I said, I've learned a lot through Dr. Leah Hetchman and just clinical practice now. And what I'm seeing, I'm just very driven to get the root cause, and I hate it when people say natural medicine doesn't work.
Yeah.
Because it's just like, what do you mean? And because to me, it's like, it is the medicine.
It is. And the thing about natural is oftentimes it takes longer, right? But I feel like as people, we've
It
gotten,
doesn't mean no conventional, though. Do you
yes,
know what I mean? It's not one or conventional can step in and help. Like I'll
totally.
use antibiotics, antiparasitics all the time.
Yeah. But oftentimes people are looking for the pill to cover up the symptom, right? Versus
Yes.
trying to figure out what is the root cause and let's treat it bringing all different modalities of medicine together. But that process often takes longer. And I think we've gotten so used to in a society of instant gratification or instant results. That's why
For sure.
that's why
We've been trained. We've been trained.
Well, and that's why the US, we spend more money on healthcare than any other country, and yet we're one of the sickest. We're like not healthy
I know.
people whatsoever. Yeah,
Oh, yeah.
especially when it comes
Yeah.
to women's health and fertility, we're one of the lowest. I mean, there's several third world countries in Africa that have better fertility outcomes than the US does. That is so sad.
Yeah, it tells us that it's not just environmental, like meaning, if there's countries in Africa and we know that there's heavy metals and we know there's pollution and that kind of
Yep.
stuff. Yeah, there's more things going on. Hopefully that will change
Hopefully.
one step at a time.
Yeah.
That's what I'm like. It brings me tremendous joy knowing that it's not the pregnancy. It's the like, my patients are sending me pictures of their babies. Like I have a couple
Aw.
with their costumes and it was adorable. And I'm
Yeah.
like, that brings me such tremendous amount of joy knowing that there's like kids out there
Yep.
who are healthy, who are also not taking junk for Halloween. And
Yep.
I'm like, my little support team.
Yeah. Yeah. That's really cool.
Katie, here's what I want to finish off with. Some dental hygiene. What are some basics that everybody should be doing? I think that everybody should be seeing a, biological dentist, but just from a perspective of
Absolutely.
What do we
Love that
need?
you're asking this question. So, best thing is you have to have an electric toothbrush. Electric toothbrush is going to clean at, 1200 strokes per minute versus manual. Such a game changer.
It is such a game changer. Like, I can't believe, because I just started using it maybe a year and a half ago. So it wasn't, and when my dentist recommended
Yeah.
it, I was like, my teeth felt so dirty.
Yep.
I was using it for like 6 minutes a day for the first week because I just felt and now obviously it's the 2 minutes, but such a game changer.
Well, and what people don't realize, because I actually did a study with Colgate with their hum toothbrush in my practice, I had patients that were in my perio protocol program. So they already had disease. And they would come in and tell me, I do brush twice a day for 2 minutes, or I brush 4 times a day for 2 minutes. They tell me all this stuff, but their gums were still a mess. And we did this study and I gave them the hum toothbrush and we were tracking. They initially were only brushing for about 30 to 45 seconds with their manual, and then they switched to hums, and the amount of time, because the electric toothbrush is going to stay on for the 2 to 3 minutes, whatever you set it to. And they were like, wow, I thought I was brushing for 2 minutes and I really wasn't. I mean, they were brushing for very short periods of time. So that's really critical. I actually tell people to put it on the deep clean setting or the gum health setting, because it'll
Three
go for
minute.
3 minutes. Yep. Have to do it twice a day, morning and night, have to. And then the other thing is, we have 5 surfaces to our teeth. We have top, the chewing surface, the cheek, the tongue, and then in between. In between the teeth is where we have the papillas or the gum tissue. That is where the blood supply is. Your toothbrush does not clean in between the teeth. So if you are only brushing and not flossing, you're cleaning 3 out of 5 surfaces and you're missing the 2 most important. So you must floss every time you brush.
That's so good. I'm so like, it's amazing because when people don't explain it, you're just like, I just must floss.
Yes. That, like, if you're gonna,
This is
if
why.
you only have time to do one thing, floss. Like I tell people, if you have to pick and choose, floss your teeth, because that's where the
Floss versus brush your teeth.
yes.
That's
Everyone's gonna
crazy.
kill
I
me for
love it.
saying that, but
I
that's where your
know,
gum
that's so
tissue
hot.
is. That's where the papilla is.
Yeah.
And so get stuff out from in between your teeth if you have to pick one. And then when you are brushing your teeth, make sure, sure, brush your teeth, but I want that toothbrush down at the gums. So point it at 45 degrees to get the bristles down at the gum line. Plaque, which is filled with all the bacteria, gets accumulated along the gum line. So sure, you can brush your teeth. That's fine. You're getting them fresh and they feel clean. That's great. What we really want to do is try and brush the plaque off the gum line. So brush around your gum line, floss every time. Use string floss, not the floss picks. Floss picks are just a modern day toothpick that is great for getting chunks of food out in between your teeth, like after you eat, but it's not actually cleaning the teeth like string floss. So have to.
Oh no, my husband is not going to like that.
I know. People are going to hate me for that. You can water pick. Water pick is like a little device that shoots water. You could water pick if you don't want to floss. That you could do.
Yep, we have that too.
Perfect.
My dentist told me to brush the teeth, not the
Brush
teeth,
the
brush
gums.
the gums.
Yes. We always say
Yep.
brush the teeth, but what we really mean is brush your gums. And gently. You don't want to apply pressure, and that's why an electric toothbrush is so good, because it will buzz at you if you're going too hard. So brush and floss are basics.
Also, your gums will bleed.
And they'll bleed, yes. Tongue scraping is really important because we have our microbiome on our tongue, and our tongues get very dirty if you think about all the stuff we put on them during the day. So make sure that you're scraping your tongue and get all the way, you should almost be gagging because you're getting so far back, because that's where all the bad breath bacteria live. And so you want to get that. Make sure you get the sides as well. And then mouthwash if you need. Mouthwash is more for freshening your breath. It's not really going to do a whole lot in terms of improving oral health. But the most critical to all of this is making sure that you're using chemical-free, non-harsh, non-toxic products. A lot of people are using, the Colgate, the Crest, the Oral-B, all that stuff. That's full of chemicals, number one. And we know that the mouth is really absorbent, right? If you have a diabetic and they are low on blood sugar and they're going to pass out, what do? They put glucose right under their tongue because it absorbs into their system very quickly. So if you're putting toothpaste in your mouth that's full of chemicals, sure, you're spitting it out, but how much of that is absorbing into your system? Quite a bit. And if you ever look at a conventional toothpaste, there's a poison warning on there saying if you ingest this, to call your poison control center. So don't put it in your mouth. Plus, we don't want to wipe out our microbiome. If something says we kill 99.9% of bacteria, that's not good, because we don't want to kill all the bacteria.
Yeah, you're putting antibiotics on your mouth every day, twice a day.
Same with alcohol. A lot of people will love Listerine mouthwash that's full of alcohol because it burns. And they'll say and I used to do this when I was a teenager. I was a dental assistant and we had concentrated soap that you'd fill with water. and we would not put as much water in it because we wanted the burn. And now I'm just thinking back like, oh my God, that was so bad. But yeah, alcohol-free, chemical-free product.
Do you have some brands that you recommend? Because
Yeah.
that was the first thing that came to mind when you said mouthwash.
Yep.
So like, what are some mouthwashes you recommend? Even for personal. So we just went through, I bought like 40 tubes of Revitin.
Yeah.
I loved it.
Yeah.
But now I'm like, should I just keep doing Revitin or should I switch it up for, 6 months? And so for personal recommendations, I'm also asking.
I love Dr. Jerry Curatola, who made Revitin, is really great. I personally like to switch things up. Number one, because I just like to try new products. Number two, I think it's always good I think the more new things you put on a system, the more you challenge it and the more robust it can be. So I personally like to change things up. Revitin is good. Feed Your Good Guys, FYGG is really good. Boka, BOKA is great. Risewell is really good. Biocidin is a really good product line. Biocidin, you have to get through a provider, a dentist provider, I believe. So those are the products I really like and recommend. But yeah, I'm always
Cool.
switching.
And do they have mouthwashes as well, or were those just toothpaste?
Nope, they have mouthwashes as well. I love Bliss Pro and Prebiotics. They have really good oral pro and prebiotics that are fantastic. They're lozenges that can dissolve in your mouth. I'm actually working with them right now to create a line. Daily Dental Care by Primal Health also has really great lozenges. They have some to prevent cavities and then some to help prevent gum infection too.
Amazing. Thank you so much for all
You're
those
welcome.
recommendations. I mean, I always like to give something to people as well, because there is the big stuff where like you got to do the testing and you got to go see the hygienist and you do the cleaning and blah, blah, blah. But then there is the like, what should you be doing every day?
Yeah.
And I think a lot of people underestimate that. Like the electric toothbrush, I'm like, I cannot believe, because I just thought it was for lazy people.
Yeah. I mean, and then just floss, like just floss your teeth. And people always say like, oh, should I oil pull? And I'm like, if you want to oil pull, to do it effectively, you have to swish oil around in your mouth for 15 to 20 minutes. I'm like,
Why don't you start with the floss first?
I can't get people to floss or even brush for 2 minutes. And now you're telling me you're going to add oil pulling to your routine? Like that's 95 percentile, right? If I could get people up to basics, we'd be so much healthier.
100%.
Another really good company that's widely available is Tom's of Maine. They're really good. You can get them at the grocery store. That's another really good, clean company.
Perfect. Thank you so much, Katie. Is there anything else that we didn't talk about that you feel like is important to mention?
No, I love that we're connecting everything. I learned a lot today, which was really fun. So thank you for sharing your knowledge with me.
No, thank you. I just love meeting all the people on the internet and learning about what we do. I think it's really great. So thank you so much for being here.
Thanks for having me.